watching Morning at NTV.
You're watching Morning at NTV. Many thanks for still staying with us. We are heavy on hashtag Morning at NTV. So let's engage and let the engagement continue. My name is Malaki Vilodera. Of course, we're doing this with Romeo Busiku, just in case you're joining us. And you can tag us directly at Malaki Vilodera and at Romeo Busiku across all the social media platforms. Now, come Sunday. Sunday will be an amazing day for the world. And right here in Uganda, we'll also make sure that we celebrate this huge day. And we're talking about the World Prematurity Day. It's going to happen on the 17th of November this year, of course, talking of Sunday. And of course, the key focus will be on creating awareness on prematures and how to ensure their safety, to ensure that these young angels actually do survive and live to having long life, so to speak, like all of us. So that's the conversation we'll be having this day, just breaking down that particular sensitive space. And of course, just to get to see where Uganda is at in terms of our capacity to ensure that premature babies actually do survive. So in studios, we are joined by Dr. Deogracius Munube. He is the president of the Uganda Pediatrics Association. He's also a consultant pediatrician. Many thanks for joining us and welcome to Morning at NTV.
Thank you, Mala. Good morning, viewers.
Good morning.
Good morning.
Thank you, NTV, for hosting us.
All right. So at what point do we classify a child being born premature?
So it's important for us to note that children, when they are in the mother's womb, they stay for a period of time. And usually we use the term 9 months. And that is equivalent to roughly 40 weeks of growing. So children who are less than 37 weeks are considered to be premature or preemies. But there's a caveat in this because, one, if you're less than 28 weeks in an African setting with very few abilities to keep the baby alive, we do not consider you that. So between 28 weeks of growth in the mother's womb and less than 37 weeks.
And less than 37 weeks.
Less than 37 weeks. So look, what really causes prematurity?
So prematurity actually starts from the mother. And one key thing that you would note is the nutrition. So when someone is growing up, is a young lady, an adolescent, their nutrition status is the first thing that's important. And when you're pregnant, your nutrition is also key. So we start with micronutrients. And these micronutrients ensure that the baby grows appropriately. That's the first thing. The second thing is hypertension. So hypertension in pregnancy is a disease entity that is unique to pregnancy. So when a mother gets hypertension, this increases the risk of having a preterm baby because the cause of the hypertension is actually the baby. So if the baby comes out, the hypertension actually goes. Thirdly are infections. So urinary tract infections are common. Infections that involve the sac that holds the baby in are also some things. And on rare occasions, abnormalities in the womb itself. The womb cannot hold or keep the baby in for the 40 weeks of gestation or growth. And then the baby comes out.
So, doctor, what role does drug abuse play in exacerbating the chances of prematurity?
That's a very important question because if you look at worldwide statistics, alcohol abuse, drugs such as marijuana, cocaine, have been noted to be a key factor. Interesting to note, in Uganda, it's not common to see a pregnant woman drinking. That's one thing. And if you think of drug use...
It's not common, but I've seen some.
Maybe in town.
Yes.
But in the villages, if you're pregnant, it's very unlikely that you'll be caught drinking alcohol. So in the bigger settings where you look at a bigger population of people, drugs and alcohol can be a big determinant.
Can they have an effect on the cognitive senses of the child being born, those drugs?
It definitely does. Drugs do affect what we call the brain development. So if your brain doesn't develop appropriately, then it causes problems. But then note that preterms, when born early, also don't have all their brain substances developed. So they're at an increased risk of these cognitive problems.
All right. You pointed out to UTIs, the urinary tract infections.
Yeah.
And we know that pregnant women are actually prone to these infections. And we always say that, you know what, if not arrested early, if it escalates, then some drugs are administered. So I want us to speak to that fact. At what point, or what are the symptoms of detecting that indeed I have a UTI, and what is the treatment like? Because most of them do over the counter, which we know is a risk for the baby, especially if you're pregnant.
Okay. The common causes of urinary tract infections are bacterial causes. And these bacteria do what we call growth within the vaginal canal, and they move up to the womb. When they reach the womb, they tend to affect the layer that protects the baby. We call that a thin layer that covers the baby. And once that happens, the infection goes in and that layer breaks. And once it breaks, the water breaks, like imagine when you're pregnant.
Right.
Then the baby will spontaneously be delivered. Treatment is usually oral antibiotics if it's a mild infection, and injectable antibiotics if it's quite severe. It's also important to note that when mothers come to pharmacies and they complain that I'm passing urine quite frequently, I have pain in the lower abdomen, most times it might be urinary tract infection, and they tend to get drugs or medicines.
And when you talked of antibiotics, so what you're saying is that a mother who's expectant should not self-medicate, because if it's antibiotics, then it has to be a doctor to prescribe that for you.
Exactly. When you're pregnant, it is a good thing and it's also a bad thing. The good thing is that you're going to have your child. The bad thing is that there are certain drugs that can affect the growth of the child.
Correct.
So your doctor should be the one prescribing. And even before that, some key investigations, just checking your urine in the lab will be even better, so that you know exactly what type of antibiotic to give.
Awesome. So which women are at risk of having premature babies?
So like I mentioned earlier, when you're young, you are at
The young
risk,
ones,
the young,
below 18.
yes. And that is, if you look at our laws, you're not allowed to get pregnant below 18. But in reality, if you look at statistics, a big percentage of our young adolescents are getting pregnant. So young because of the nutrition. 2, elderly mothers who tend to have first pregnancies quite later.
What is elderly? Can you put an age to it?
So remember, for you to be in the reproductive age, you go up to about 40 and close to 50. So when we say elderly, I'm talking about most of our working class who start having children from 35 years and above 40. That increases the risk of prematurity, mainly because of hypertension. But I must say,
35.
I must say, I was born when my mom was going towards her 40s, and
Wow.
and you can see where I am. So
Yeah.
it's really the importance of you knowing that you're having what we call a precious baby, and that's the terminology used, and you do attend your antenatal. They check your urine, they check your blood pressure, you receive all the basic requirements. And if they find out that there's any risk of you delivering early, there are some key interventions that are done.
Okay.
Yes.
All right. Now, you know, when you look at the premature babies, I think we can flip the coin now to taking care of this child. We know world over, if a child is born at 20 weeks, they still have a chance of survival. But when we're looking at statistics right here and our capability right here in Uganda, we're looking at 28 weeks. And still the survival rate is very slim. Let's talk about that. When you have a premature baby, a preemie born, what should be the first, you know, pretty much intervention for this child to be able to survive? Do we say we have a gap, or what ought to be done in terms of practices, the high standards?
So I would just take you back just one step. So before the baby is born, we have the mother.
Yes.
So the mother would have labor-like complaints. And if you calculate her expected date of delivery, it will be less than 37 weeks. So in the hospital, they actually prepare the baby to come out early. They give steroids
To the mother.
to the mother
Okay.
to ensure that the lungs can mature, anticipating an early delivery. Once the baby comes out, and in most facilities that we have, we provide what you call kangaroo mother care. This is a skin-to-skin contact of the baby with the mother to ensure that the baby has an increased opportunity to survive. It keeps the baby warm. It allows the mother to monitor the baby. It also allows the mother to breastfeed on demand. And it also has been shown to reduce the infections that babies that are born preemies do have.
Is it more effective than putting a baby in the incubator? Because that has always been the debate.
I would say in our setting, in an African setting, the cost of putting a baby in an incubator is not realistic. We have Kangaroo mother care, and I must say we should also say KFC, Kangaroo father care,
Yes.
such that it
That's
is
a good
both the mothers and the fathers who take responsibility in caring for this child. Just imagine you have a child who is born at 28 weeks, and you have to grow that child to 40 weeks to be sure that the baby is alive and well. And that means you're going to stay in the hospital for 12 weeks,
Right.
3 months. The costs are extremely high.
But kangaroo care is also equally effective. That's what you're saying.
Kangaroo mother care is equally effective. It has been shown to reduce death associated to prematurity. It has improved growth of the children. And currently in Uganda, interestingly, we have a very large study that is looking at kangaroo mother care in our setting and how it helps to improve the outcomes.
So, doctor, besides kangaroo care and all that, how do you tell that a baby is premature in the first place? How do you identify a premature baby?
So the first thing is the mother's gestation age. When the baby is born, we do have some what we call guidelines on how to estimate the age. So you find one, the baby has very thin, shiny skin. Two, the nipples are not mature. Normally your nipples are dark and round. You would actually not be able to see. The genital areas are actually normally dark and hyperpigmented, as we call it, but you would find it's light and red, almost pink. And the baby's movements are actually abnormal. So that's how we actually tell.
So let's talk about how you can take care of a premature baby after delivery. How best can you take care of that child?
The most important thing, and I would like to emphasize it, is breastfeeding. The breastfeeding is the initial aspect. It helps to prepare the baby very early for this long journey.
But new mothers in this modern world are actually shying away from breastfeeding. What advice do you have for them?
Breastfeeding is good. Breastfeeding is safe. Breastfeeding is cheap. It's readily available, and it's clean.
So besides breastfeeding, what other avenues can we use to take care of a premature baby?
So warmth is another key aspect. If you remember from secondary school, the smaller you are, the larger your surface area is. So because these babies are so small, they lose a lot of heat. A lot of heat. So keeping them warm is very important. Maturation of or growth of the body will take place. And actually, important to note is they actually catch up. They try to grow as fast as possible. And really, during this World Prematurity Day, there are some key things that we're trying to look at. Improving the right care, providing that care in the right time and in the right place.
And in the right
Let's talk about stereotypes for a bit. There are rumors that babies that are born prematurely do not have the best cognitive senses than those that are actually born after 9 months. Is it true that if you're born premature, your cognitive senses would be lower than that person who was born after 9 months?
So as I mentioned earlier, the brain growth is inhibited because one, as you're growing into your 40th week, all the neurons or the nerves or the small parts of the brain mature. In these preterms, that is held back because you have not reached the time. But what we know is that when they are born, if we provide appropriate care, they reduce the risk of having what you call cognitive or brain development disabilities.
Only reduce.
Reduce. Why do I say reduce? Because we have a lot of information which shows if you're preterm with no form of intervention, then you end up with what we call cognitive disabilities. So you're not able to learn appropriately. Some of the interventions that we do can cause you to have lack of sight. Some of them can cause you to have lack of hearing. So there are some key things. But I can tell you, I have quite a number of colleagues who were born preterm and actually doctors.
Actually, that was going to be my next question, but thank you very much.
Doctor, you know, when we
Yeah.
look at premature babies, weight is also an issue.
Yes.
It's also a big question. Now, the first question would be, in terms of the growth of this premature baby, you know, a preemie, how, for us to gauge the progress of this child, what should be the ideal weight, growth rate for the weight?
So most babies are born on average between 2.5 kilos and 3.5 kilos. If you start going above 3.5, those are big babies. I don't know what the weights of your babies were, but you would find if you go into the 4 kilos, that's really big. Going down, if you're less than 2 kilos or 2,000 grams, then you're having a little bit of a challenge, especially when you're preterm.
When you're preterm.
You're
So
preterm.
what should be the expected rate of gain weight
So
for a
the,
premature baby?
so the gain or expected weight is normally calculated on a daily event. So what happens is when the mothers come for review after discharge, we tell them that we're going to calculate your weight growth. So we expect that every week your child should put on about 100 grams every week as we move forward. Sometimes the mothers don't achieve that, mainly because one, it's a very stressful period.
Right.
You have a baby who you would like to breastfeed but is not taking all the milk at once. Two, you have a baby who requires you to hold the baby most of the time. So if you don't have a lot of social support, then you get a little bit of a challenge.
Right. And let me ask you a question, doctor, before we get into the other question is, a child who's already gotten to the 38th mark, because we always say that from 38 weeks to 40 weeks, that's an okay child.
Yes.
You know, that's not a premature child, but is born underweight. Do we categorize that child as premature, or do we say that then the care given to this child will be similar to that given to a preemie?
So the term we use is small for gestation age.
Okay.
So you have a child who you anticipate that the child's weight is supposed to be, let's say, 3 kilos, but in the last trimester or just before the child is born, there may be some difficult aspects, and the child's weight goes less. So that child is not considered a preemie, is considered a small for gestation age.
Okay.
And the management is different because the rest of your body is mature. We don't limit how we treat or manage you. What is important is we just consider the keeping warm, which means your regular dressing and your regular feeding.
Right.
So, doctor, can prematurity be prevented?
I would say yes, it can be prevented. It starts from nutrition. That's one. Two, it starts from the mothers attending their antenatal visits. In Uganda, it's recommended that you should have at least 4 antenatal visits. And during that visit time, there are some key assessments done. They do a scan of the womb to see the baby's age. They look for any abnormalities. They check your blood pressure to make sure that your blood pressure is not high. They provide you with supplements, folic acid, iron, because your blood levels need to be normal. Your baby's neurotube defects, if you've ever heard of that term, need to be prevented, and that can be prevented by giving folic acid to the mothers. And then, of course, your growth and complications related to pregnancy. So those are key things that enable us to actually prevent it. And lastly, emphasizing the drugs.
The drugs.
The drugs. If you are a pregnant mother, we do not recommend any form of drugs. Alcohol, marijuana, all the things that you can think of that are not prescribed medicines, we recommend that you don't use them.
Doctor, according to a recent study, pollution was fronted as one of the major factors, leading to expectant mothers having their babies premature. What do you make of that? Pollution.
So
what is the What is the correlation between pollution and having babies premature?
So pollution, one, goes hand in hand in industrialization. So some of the studies that have been done have looked at countries where there's been a rapid rise in industrialization, and pollution leads to toxins. Toxins are bad. It doesn't matter whether you're pregnant or not, but it has been noted, just like smoking, it takes over the similar toxins like smoking, which affects the mother, which leads to early deliveries. So you have infections in the lungs, you have infections in the wombs, and you can also have stress, which can lead to early prematurity.
Talking of stress, you know, whenever we're having conversations as, you know, with our doctors when we're expectant, I'm talking from experience. The doctors always caution expectant women not to strain themselves so much physically because it could be a trigger. Talk to us about that. At what point? Because, you know, women who work from, you know, day one to the last day. So what is acceptable and what is not acceptable in terms of mental strain, physical strain, emotional strain? Just let us in on how this come into play with regards to the health of the child and preventing the eventuality of a miscarriage or having a premature baby.
So one thing that you should note is that if you look at two populations in Uganda, let's say the working class versus the rural class, I would tell you in the villages, the mothers work until they even deliver.
Correct.
And interestingly, they even go to the farm and come back with a baby. Now, if you...
A healthy baby at that.
If you look at the urban centers, there are many other stressful events that could occur. Work, time of work, background towards the person's working. So it's really a very thin layer between what you require and what you don't. But if you do have a medical complication that is associated with your pregnancy, hypertension, diabetes, recurrent infections in your pregnancy, you actually are given time off, and you would find that that is something that is appropriate. So there is no clear time. What is clear is that the condition that you have in pregnancy really determines what amount of work you can do and what you cannot do.
Doctor, is there any incidence or scenario where a child is born after 9 months, but still they have a problem with their cognitive abilities?
Yes, that is very possible.
What causes that?
Usually it is difficulty in delivery. So if you've heard the term obstructed labor, where a child is supposed to be delivered within a specific period of time, and there's a delay, and there's a further delay, and the baby is born when the baby is not breathing appropriately, they end up with damage to their brain, and they end up with a terminology called cerebral palsies. Yes.
Okay, cerebral palsy. And let's not just let that conversation hanging. Cerebral palsy, how do you go about identifying, number one, that this is a child who's been affected at birth? Of course, with the obstructed labor and all that, can it be detected early and intervention made at an early stage? Because it is an issue for a majority of children, and of course it causes a lot of strain to families.
So I think I'll just highlight quickly, because obstructed labor does occur in our communities, and it leads to lack of oxygen going to the brain. Our neurons or our nerves require oxygen to do most of the activities that take place. And when that occurs, they actually die. And when the child is born, they have what we call difficulty in breathing. They tend to have convulsions or seizures, and these seizures might be very quiet. They can be very subtle. It might be as simple as a child just lip smacking, or the eyes darting from side to side. And in some worst cases, they could even be cycling. You can imagine your newborn baby is just cycling into the air. And this can be detected using some simple brain imaging techniques, the EEG, or it looks at the electrical activity in the brain, which shows that there's something abnormal. So you can actually pick this up early, both clinically as you examine the child and also with some few investigations.
Is it reversible?
Unfortunately, it is not reversible.
So, doctor, can exercises help prevent this problem of having babies born prematurely? Exercises, regular exercises if you're pregnant.
I think exercise, whether pregnant or not pregnant, is very important. There is no clear association that having increased exercise would reduce the risk of prematurity. Yeah.
And according to another recent study, it was being said that even the slightest of alcohol being taken can have health complications. Let's say you've taken a year or two without taking any. The moment you try even a glass, could have consequences right there when it comes to your health. So when it comes to the mothers, a viewer might want to know, if a mother is exercising caution and says, okay, I'm going to take one beer, will it still have consequences on her health?
I think in terms of the amount or what the alcohol itself can do to you, people have different thresholds for alcohol use, and I think it's important that you just put a clean line and you state when pregnant, alcohol should not be used.
Okay, all right. So something great is happening on Sunday. Uganda also will be marking the World Prematurity Day, and it's going to happen in Busia. Tell us a few details about that.
Thank you. So the world actually every year on the 17th of November celebrates the World Prematurity Day. In Uganda, the Ministry of Health has selected Busia district to be the district where the activities and the celebrations will take place. And the importance of this day is to create awareness.
All right.
And I had mentioned earlier the theme. It is right care at the right time in the right place.
In the right place.
Because babies are born too soon, and we want to really see how we can improve their outcomes.
All right.
And this really is for me to emphasize the need for Kangaroo mother care. It is safe, it is cheap, it is available for all of us, and it can be shared with both the mother and the father.
The mother and the father. Interesting right there. The fathers also have a role to play. Thank you so much for coming through, Dr. Deogracious Munube, President of the Uganda Pediatric Association, and also he is also a consultant pediatrician. At this point in time, we'd like to link to Mr. Romeo for your birthday wishes this morning. Romeo, what do we have in store? All right, so we'll be getting into that. Many thanks for coming, Doctor. Of course, you can, if you're around Busia, you can make sure that you make your way out there. There will be heavy on information with regards to awareness, with regards to care of these amazing angels that come to our lives, of course, earlier than expected, but there still is a chance for survival. He did point out to 28 weeks. At 28 weeks within Uganda, that child can still survive. Of course, globally, we're looking at 20 weeks. Yeah, globally, of course, we know the critical issues with regards to equipment and all these other things. In globally, yes, a child born at 20 weeks can survive, but in Uganda, we're looking at 28 weeks. And like doctor says, he is insisting on Kangaroo mother or father care. And of course, that comes with providing this warmth to the child and ensuring that this child does grow. Of course, we'll be getting into the details of those come Sunday. If we can, we'll be going directly, of course, linking directly to Busia just to ensure that we loop you in on what's happening on this particular special day, the World Prematurity Day. If you have questions, keep them coming on #morning@NTV. You can also tag me directly at Malaki Vilodera or at Romeo Busiku. Send through the questions, and of course, Doctor will be able to look at those. At this point in time, it seems that we're not able to link to Romeo for your birthday wishes. So right here at NTV, Morning at NTV, we'd like to say many thanks for allowing us into your lives, into your offices, your homes, every single morning from Monday to Friday, 6:30 to 9 a.m. We have to pave way for Mwasu's MTS, so do have yourselves a blessed day. Go ye out and make it work. See you tomorrow. Bye-bye.